Hello, my name is Alicia Aguilar. Today I will be presenting my quality improvement project that addresses reducing non-urgent emergency department visits by educating patients on the effective utilization of primary care. I chose this project because overcrowding in the emergency department is an alarming global healthcare problem. Overcrowding can cause treatment delays, decline in the quality of care provided, and result in poor patient outcomes. Patients who go to the emergency department for non-urgent complaints and primary care visits are a substantial contribution to ED overcrowding. This initiative provides the opportunity for improvement by enhancing the management of patients who have chronic health concerns by establishing primary care options, thereby reducing their frequent visits to the emergency department. This will benefit the patient by providing effective, efficient, cost-effective healthcare delivery and will also result in improved patient outcomes. The goal for improvement is to reduce the frequency of emergency department visits for patients with chronic conditions by 25% within the next 6 months. Non-urgent visits to the emergency department can have a detrimental effect not only on the quality of treatment that is delivered, but also on the level of satisfaction experienced by patients and staff. Treating non-emergent patients can impose a strain on the available staff and resources and result in higher wait times for patients who have true medical emergencies. Establishing patients with a primary care provider will ensure continuity of care. The comprehensive care provided by a primary care provider includes preventive measures and management of chronic diseases. This type of care results in better health outcomes and an increase in patient satisfaction. It also reduces the likelihood of patients returning to the emergency department for non-emergent conditions. Patients may experience difficulties in accessing primary care due to a variety of factors, including lack of health insurance, an inability to take time off of work for visits, difficulties in obtaining transportation, and also a shortage of healthcare providers. Financial concerns, including high healthcare costs, high deductibles, and copays, may also deter patients from seeking primary care. In addition, the general lack of awareness that an individual has regarding the significance of preventative care and the accessibility of primary care services may also discourage them from seeking primary care. Some of these obstacles can be overcome with the support of a comprehensive strategy that emphasizes the need for health literacy and education and creates a network of referrals to community clinics. Evidence suggests that patients who are followed by primary care report higher patient satisfaction and have better overall health outcomes. United States adults who regularly see a primary care physician have a 33% lower healthcare cost and 19% lower odds of dying prematurely than those who only see specialists. In addition, the United States could save $67 billion each year if everyone used primary care providers as their principal source of care. To educate patients on the importance of primary care, educational packets will be prepared and distributed to patients who present to the emergency department for non-emergent care. The benefits of primary care, which include both comprehensive and preventative care, will be included in these packets. It will also include details about the community clinics that are managed by our facility, including contact information so that appointments can be made. The packet will also contain information regarding resources available to patients who do not have insurance. This will include the contact information for the hospital liaison, who may assist the patient in applying for government benefits should they be eligible for such assistance. Follow-up phone calls will be made to each referred patient to determine whether they have been successful in establishing primary care. In the event the patient is unsuccessful, assistance in scheduling the appointment will be offered to them. This initiative has the potential to have an impact on a number of different population groups. Patients will benefit if they are able to receive care that is both comprehensive and of high quality, which would lead to better patient outcomes. Healthcare providers will benefit from a decrease in the number of patients with non-urgent conditions, which will enable them to focus their attention and resources to patients with genuine emergencies. And the community as a whole will benefit from reduced wait times in the emergency department and a decrease in healthcare costs. The electronic health records from the emergency department and community clinics will be the data sources used to evaluate the effectiveness of this intervention. Records will be kept of patients referred to the clinics, and follow-ups will be made to ensure that the patient has set up an initial appointment in a timely manner. Emergency department records will be monitored to evaluate the number of repeat visits made by patients for non-urgent care. Patient surveys and patient callbacks from the emergency department can be utilized to determine if the patients have successfully established their primary care. Reducing frequent emergency department visits for patients with chronic health conditions will result in a more efficient, patient-centered healthcare system. Patients will benefit from improved coordinated care. Healthcare providers and hospitals will benefit from optimized resource allocation and reduced cost. Overall, I believe this project can contribute to better healthcare outcomes and a healthier patient population.